How does a blood pressure tablet actually work? Every morning, more than 1 billion people around the world swallow a tiny tablet just like this. A simple pill that quietly works behind the scenes, helping to prevent strokes, heart attacks, and other life-threatening conditions, often for decades. But have you ever stopped to ask yourself one simple question? How does a tablet you swallow actually reach the blood vessels deep inside your body and lower your blood pressure? Today, we're following one of the world's most prescribed medicines, Amlodipine, on an incredible journey from your mouth to your artery walls. By the end of this video, you'll understand exactly how this tiny tablet protects millions of lives every single day. Before we follow the medicine, we first need to understand the problem it's designed to solve. Your heart beats around 70 times every minute, pumping blood through thousands of kilometers of blood vessels. Every heartbeat creates pressure that pushes oxygen and nutrients to every organ in your body. A healthy blood pressure is typically around 120/80. The top number measures the pressure when the heart contracts, while the bottom number measures the pressure when the heart relaxes between beats. But when the arteries become too narrow, stiff, or tight, the heart has to pump much harder to move blood through them. This constant extra effort slowly damages the heart, brain, kidneys, and blood vessels, increasing the risk of stroke, heart attack, heart failure, and kidney disease. The goal of blood pressure medication isn't simply to affect the heart. Its real mission is to relax the arteries, making it easier for blood to flow. And that's exactly where amlodipine comes in. Amlodipine is one of the most widely prescribed blood pressure medicines in the world. Even though a typical tablet contains only 5 milligrams of medicine, it's remarkably powerful. It belongs to a group of medicines known as calcium channel blockers. That name may sound complicated, but once you understand how it works, you'll never forget it. One important thing to remember is that amlodipine doesn't primarily target the heart. Its true target is the muscular wall of your arteries. Now, let's begin the journey. After swallowing the tablet with a glass of water, it quickly reaches your stomach. Within the next 30 to 60 minutes, the tablet dissolves, releasing amlodipine molecules into the digestive system. From there, the medicine moves into the small intestine, where most absorption takes place. The inner lining of the intestine is covered with millions of tiny finger-like structures called villi. These structures dramatically increase the surface area available for absorbing nutrients and medicines. Amlodipine molecules pass through the intestinal wall and enter tiny blood vessels waiting beneath the surface. One remarkable feature of amlodipine is its excellent absorption. Between 60 and 90% of the medicine you swallow successfully enters your bloodstream, making even a tiny dose highly effective. Before reaching the rest of the body, however, the medicine must first pass through the liver. This process is called the first pass effect. Many medicines are significantly broken down during this stage, reducing the amount that reaches circulation. Fortunately, amlodipine survives this journey extremely well. Although liver enzymes known as CYP3A4 begin processing the drug, most of the absorbed medicine passes through the liver and enters the bloodstream intact. This is one reason why amlodipine delivers reliable and predictable results. However, this stage also highlights an important safety point. Certain medicines, including some antibiotics, antifungal drugs, and even grapefruit juice, can block these liver enzymes. When that happens, more amlodipine remains in the bloodstream than intended, potentially lowering blood pressure too much. That's why your healthcare provider always asks about the other medicines you're taking. Once in the bloodstream, amlodipine travels throughout the body. Most of the medicine temporarily attaches itself to a protein called albumin. You can think of albumin as a transportation system, carrying the medicine safely through your circulation until it reaches its destination. Another unique feature of amlodipine is how long it stays active. Its half-life ranges from 35 to 50 hours. This means one daily tablet provides smooth, continuous blood pressure control throughout the day and night without large peaks or sudden drops. Now we arrive at the most important part of the journey, the artery wall. Arteries aren't simply hollow tubes. Their walls contain smooth muscle cells that constantly adjust how wide or narrow the blood vessels become. When these muscles contract, the artery becomes narrower, increasing resistance and raising blood pressure. Inside every smooth muscle cell are tiny gateways called L-type calcium channels. When these channels open, calcium enters the cell. Calcium acts as the signal that tells the muscle to contract. More calcium means tighter muscles. Tighter muscles mean narrower arteries, and narrower arteries mean higher blood pressure. This is exactly where amlodipine performs its remarkable job. The medicine attaches itself directly to these calcium channels and blocks them. With the channels blocked, calcium can no longer enter the muscle cells. Without calcium, the muscles lose the signal to contract. They begin to relax. As the muscle relaxes, the artery widens. This process is called vasodilation. Wider arteries allow blood to flow much more easily, reducing resistance throughout the circulatory system. The heart no longer has to push against tight blood vessels. Blood pressure falls naturally. With lower blood pressure comes a significantly lower risk of stroke, heart attack, kidney damage, and other complications associated with hypertension. But amlodipine doesn't stop there. It also relaxes the coronary arteries, the blood vessels that supply oxygen directly to the heart muscle itself. As these arteries widen, more oxygen-rich blood reaches the heart. That's why amlodipine is also commonly prescribed for people experiencing angina or chest pain caused by reduced blood flow to the heart. In summary, amlodipine performs three important functions. First, it relaxes arteries throughout the body, reducing resistance and lowering blood pressure. Second, it widens the coronary arteries, improving blood flow and oxygen delivery to the heart muscle. And third, thanks to its long-lasting action, a single tablet provides steady protection for an entire day. It's remarkable to think that such a tiny tablet can quietly perform all of these life-saving tasks every single day. So the next time you see a blood pressure tablet, remember what's happening behind the scenes. It's not simply lowering a number on a blood pressure monitor. It's traveling through your digestive system, surviving the liver, circulating through your bloodstream, finding tiny calcium channels inside your artery walls, and gently relaxing your blood vessels so your heart doesn't have to work as hard. That's the incredible science behind amlodipine. If you or someone you know takes blood pressure medication, remember never to stop taking it without first consulting a healthcare professional. Consistent treatment is one of the most effective ways to protect the heart, brain, kidneys, and blood vessels over the long term. Thank you for watching. If you enjoyed learning the science behind everyday medicines, subscribe for more medical journeys as we continue exploring how the treatments we rely on every day work inside the human body. Stay curious, stay healthy, and I'll see you in the next episode. These contents are developed and authorized by registered pharmacist Darius IV and by Doctors Academy, an initiative of
Ireve Biotech.
the home of doctors' products.